Gary Carnes from All Children's Health System in St. Petersburg, Florida. Advocacy for kids is a very important part of what we do as a healthcare system, but also very important as just a way of being a good citizen in the United States on behalf of children who don't really have a great voice for themselves. Well, children currently are the most overlooked part of society relative to insurance or healthcare provision. So it's very important to include them in the national discussion. You really need a few key things for kids. You need eligibility. They all need to be able to get into the insurance program in some way or another. You need access. You need to be able to get them in to see physicians at whatever level they need. And thirdly, you need to pay the physicians and the providers adequately so that they're willing to take those kids into the practice and treat them as they needed to be. So it's a complex formula, and it certainly probably is an expensive formula, but it's something that has to be done for the future of our country. It's critical for children to have health care simply to live their life. They have to have access to primary care. That's where it begins, so that the little things that come up can be taken care of, immunizations, things like that. But also for the children we treat at All Children's Health System, the sickest of the sick kids, we have, our hospital is primarily a big intensive care unit. We get children that are very difficult to treat. The problems are very costly to treat, and they can be lifelong issues that the child will have to deal with into adulthood. So getting them started at the very beginning and then treating whatever's wrong with them is absolutely important. And for those safety net hospitals like All Children's who treat these sick kids, they have to have adequate funding, or we're not going to be able to provide the services that we need as children mature through life. Our message from All Children's would be to proceed slowly, carefully. You need to be able to provide services to children when they need them, at the proper level that they need. Most of the time it's in a doctor's office and everything can be taken care of. But for those kids who really have significant problems and they need to get to a hospital, they need a hospital like All Children's and the other children's hospitals in the country, you have to have the ability to bring together the resources to take care of those kids. Adequate payment has to be there, or you will not be able to amass the resources you need. So proceed slowly, make sure you have a system that is designed to treat kids and not an adult system that's trying to be modified to take care of children.